Millions of people in the United States deal with kidney issues every single day, often without knowing how much damage has already been done. Chronic kidney disease is not just a silent epidemic, it's often irreversible. But what if your daily habits, especially your nutrient intake, could make a difference before it's too late? Certain vitamins play a critical role in supporting kidney health, yet they're either ignored or misunderstood by many people across the United States, Canada, the United Kingdom, and Australia. And the truth is, neglecting these key nutrients could be contributing to kidney decline without you realizing it. The kidneys filter nearly 50 gallons of blood every single day. They remove waste, regulate fluid levels, manage electrolytes, and help control blood pressure. Yet even with all this responsibility, they're among the most underappreciated organs in our entire body. When kidneys start to struggle, the signs can be subtle: slight swelling in the ankles, fatigue, trouble concentrating. By the time clear symptoms show up, it can already be too late. That's why focusing on kidney-supportive vitamins is not optional. It's essential, especially if you live in the United States, where the standard diet is heavily processed, high in sodium, and deficient in key nutrients. Let's start with vitamin B1, also known as thiamine. This vitamin is crucial for energy metabolism, but what many don't know is that it helps protect kidney tissues from high blood sugar. And that matters, especially since diabetes is the #1 cause of kidney failure in the United States. Thiamine helps reduce advanced glycation end products, those toxic byproducts that accumulate in kidney tissue due to chronically high glucose levels. In a study conducted on patients with type 2 diabetes and microalbuminuria, high-dose thiamine supplementation reduced the amount of protein leaking into the urine, which is one of the first signs of kidney damage. Most people don't get enough thiamine through food, especially those eating typical American fast food diets. And even worse, alcohol and certain medications deplete thiamine even further. People taking diuretics, like hydrochlorothiazide or furosemide, which are commonly prescribed in United States clinics for high blood pressure, are at a higher risk for deficiency. Vitamin B6, or pyridoxine, is another vital nutrient for your kidneys. It's involved in over 100 enzyme reactions in the body, and it plays a massive role in reducing homocysteine, an amino acid that becomes toxic at high levels and damages blood vessels, including those in the kidneys. High homocysteine is linked to faster progression of chronic kidney disease. This is especially critical for older adults in the United States and Canada, who tend to have low B6 levels due to declining absorption with age. But it gets more serious. Low B6 levels also increase the risk of developing oxalate kidney stones. Without enough B6, oxalate builds up and binds with calcium to form sharp crystals that tear through kidney tissues. If you've ever experienced the agony of passing a kidney stone, you know it's not something you want to risk again. It's deeply painful, and it's often completely preventable with proper B6 intake. This is especially important for people following low-carb or keto diets, which are becoming popular in United States weight loss clinics, but can spike oxalate levels dramatically if not managed properly. Moving to vitamin C, people are often confused about its role in kidney health. Some think it's dangerous because of the potential to form oxalates, but that risk is only associated with megadoses, usually over 2,000 antioxidants daily, taken for long periods. At appropriate doses, vitamin C acts as a powerful antioxidant, helping reduce inflammation in kidney tissues. Inflammation is a key driver of all chronic diseases, including nephropathy. In people with high blood pressure or early-stage kidney dysfunction, vitamin C has been shown to reduce C-reactive protein, a key marker of systemic inflammation. That's a big deal, especially for patients in the United Kingdom and Australia, where hypertension-related kidney problems are sharply rising. But again, dose matters. The sweet spot seems to be between 250–500 million daily. Taking more than that, especially without hydration, can push the kidneys into oxalate overload. But at proper levels, it helps repair and protect the delicate glomeruli, the microscopic filters inside your kidneys. Vitamin D is one of the most studied vitamins in connection with kidney health, and for good reason. The kidneys actually convert inactive vitamin D into its active form, called calcitriol. When kidney function drops, so does this conversion, leading to widespread vitamin D deficiency. And it's not just about bone health. Vitamin D regulates blood pressure, reduces inflammation, improves insulin sensitivity, and even supports immune function, all things directly tied to kidney function. A lack of vitamin D has been linked to faster progression of CKD, especially in minority populations. In the United States, where darker skin reduces vitamin D synthesis from sunlight, people with obesity, diabetes, and high blood pressure, the three major kidney risk factors, are the same ones most likely to be deficient in vitamin D. Supplementing with D3 has been shown to slow the progression of kidney disease, especially when paired with magnesium, which is essential for vitamin D metabolism. In Canada and northern U.S. states, where winters are long and sun exposure is limited, deficiency rates are sky-high, especially among elderly populations who are also the most vulnerable to renal decline. Vitamin B12 is often neglected when discussing kidney health, yet its importance cannot be overstated. Like B6, it helps control homocysteine levels. But there's something even more critical. Patients with kidney disease often have difficulty absorbing B12 from food due to impaired stomach acid production and changes in protein metabolism. On top of that, dialysis patients in the United States routinely show dangerously low B12 levels, which contributes to anemia, nerve damage, and worsening fatigue. And here's where it gets dangerous. Many people with early-stage kidney disease are given proton pump inhibitors, like omeprazole or pantoprazole, to manage acid reflux. But these drugs reduce B12 absorption dramatically. This means millions of people are unknowingly putting their kidneys at risk just by following what they think is normal treatment. Injectable or sublingual B12 bypasses these absorption issues and is especially important for vegetarians and vegans, since B12 is almost exclusively found in animal products. Another absolutely critical vitamin for kidney support is vitamin E. But not just any form. Most people take alpha-tocopherol, the common form found in U.S. multivitamins, but that's not the most protective form for kidneys. Tocotrienols, a lesser-known class of vitamin E compounds, have much stronger antioxidant and anti-inflammatory properties. In several studies on people with diabetic nephropathy, tocotrienols reduced proteinuria and slowed the progression of kidney damage far more effectively than traditional vitamin E. They protect against oxidative stress, one of the most aggressive forms of kidney tissue damage, especially in people with high blood sugar or exposure to environmental toxins. And unlike alpha-tocopherol, tocotrienols don't interfere with vitamin K metabolism, which is important because vitamin K is also vital for preventing vascular calcification, a common and dangerous complication in kidney disease. Folate, or vitamin B9, is another powerhouse for kidney protection. It's deeply involved in detoxification and reducing homocysteine, just like B6 and B12. But more than that, folate is essential for repairing damaged DNA in kidney cells. People in the United States consuming processed foods often get synthetic folic acid instead of natural folate, and that's a problem. Folic acid has to be converted in the liver using an enzyme called MTHFR, which up to 40% of Americans have a mutation in. That means they can't activate folic acid properly, leading to buildup and even toxicity in some cases. The best form is methylfolate, which is already active and usable by the body. In a long-term clinical trial on people with chronic kidney disease in Australia, methylfolate supplementation reduced homocysteine levels, slowed kidney decline, and even improved cardiovascular markers, which is important because heart disease is the #1 cause of death in people with kidney issues. The interconnectedness of kidney health and vascular health cannot be overstated. If the blood vessels are inflamed, narrowed, or calcified, the kidneys suffer first. Vitamin K2 is one of the most overlooked but most powerful vitamins when it comes to kidney health, especially for preventing one of the deadliest complications, vascular calcification. When calcium builds up in arteries instead of bones, the kidneys become highly vulnerable to damage. This is incredibly common in people with chronic kidney disease in the United States, especially those undergoing dialysis. The kidneys are responsible for regulating calcium and phosphorus, and when they start to fail, calcium often ends up in the wrong places. K2 activates a protein called matrix GLA protein, which literally pulls calcium out of soft tissues like blood vessels and helps redirect it to bones. Without enough K2, calcium hardens in arteries, chokes off blood supply, and speeds up kidney failure. The standard American diet contains almost no K2 because it's mostly found in fermented foods like natto or grass-fed dairy, which most people rarely eat. And unlike K1, which helps with clotting, K2 specifically targets the calcification problem. A clinical study in Canada showed that supplementing with K2 reduced arterial stiffness in patients with kidney disease, improving both cardiovascular and renal outcomes. K2 is especially important for those taking vitamin D, because D increases calcium absorption. And if that calcium doesn't get directed properly, it becomes a threat rather than a benefit. Magnesium may not be a vitamin, but it works hand in hand with nearly every other kidney-supportive nutrient and must be included. Low magnesium levels are a hidden epidemic in the United States, where processed food consumption is extremely high and soil depletion has stripped natural sources from vegetables. Magnesium helps balance calcium, reduce blood pressure, control blood sugar, and suppress inflammation, all of which are essential for kidney preservation. It also prevents the formation of calcium oxalate crystals, the most common type of kidney stone. What's tragic is that many people with early kidney disease are told to avoid magnesium because of concerns about buildup. But in early and moderate stages, controlled supplementation can actually slow the progression of kidney damage. In one large observational study in the United Kingdom, individuals with the highest dietary magnesium intake had significantly lower rates of kidney dysfunction, even after adjusting for blood pressure, glucose levels, and medication use. Magnesium also plays a role in protecting mitochondrial function in the kidneys, those tiny energy factories that determine how well your cells survive oxidative stress. If mitochondria are damaged, kidney cells lose the ability to regenerate, and that opens the door to irreversible decline. Coenzyme Q10, while technically not a vitamin, is essential to mention here because of how much it supports kidney energy, production, and reduces oxidative stress. It's produced in the body, but declines sharply with age, especially in people taking statins, which are some of the most commonly prescribed drugs for high cholesterol in the United States, Canada, and Australia. Statins lower cholesterol, yes, but they also deplete CoQ10 dramatically. And without it, kidney cells struggle to produce ATP, the basic unit of energy for cellular repair and detoxification. Clinical trials have shown that CoQ10 supplementation can lower creatinine levels, reduce proteinuria, and improve overall kidney function, especially in people with diabetes-related nephropathy. One double-blind, placebo-controlled study found that CoQ10 supplementation over 12 weeks significantly improved glomerular filtration rates in patients with stage 3 kidney disease. The emotional impact of this cannot be understated. Patients tease. reported less fatigue, clearer thinking, and more energy just from restoring their cells' ability to function. In the United States, where nearly 1 in 7 adults has some form of kidney disease, most of them undiagnosed, this could be a game changer. There's also growing interest in omega-3 fatty acids and their role in kidney protection, particularly EPA and DHA found in fish oil. Omega-3s reduce inflammation at a deep cellular level, help lower triglycerides, and protect blood vessels, all essential for maintaining kidney health. In people with lupus nephritis or IgA nephropathy, omega-3 supplementation has been shown to slow disease progression and reduce inflammatory markers. And it goes beyond autoimmune causes. Studies from Australia and the United Kingdom found that regular omega-3 intake was associated with slower decline in GFR and reduced need for dialysis in aging populations. For Americans, the challenge is even greater because typical diets are packed with omega-6 inflammatory oils from soybean, corn, and processed snacks. The omega-3 to omega-6 ratio is way out of balance, fueling chronic inflammation that quietly damages the kidneys over decades. Taking a high-quality fish oil or algae oil supplement can help restore this balance, especially in people with early signs of hypertension or blood sugar issues. Let's not forget about N-acetylcysteine, NNAC, a precursor to glutathione. The body's master antioxidant. NAC has been used in clinical settings in the United States to prevent contrast-induced nephropathy during imaging procedures like CT scans and angiograms. This alone tells you how powerful it is for kidney protection. It helps neutralize free radicals and protects renal tubules from oxidative damage. In chronic kidney disease, glutathione levels are almost always low, and this leads to mitochondrial dysfunction, higher inflammation, and faster progression to end-stage renal failure. NAC supplementation has shown promising results in reducing creatinine, lowering oxidative markers, and improving filtration efficiency. People who smoke are exposed to environmental toxins or take multiple prescription medications, a very common scenario among elderly Americans, are especially vulnerable to oxidative kidney damage. NAC not only helps restore glutathione, but also has mucolytic properties that benefit lung health, creating a double benefit for people dealing with multiple chronic issues. Many experts also now emphasize the role of alpha-lipoic acid, a powerful antioxidant that works in both fat and water environments, making it uniquely effective at protecting kidney cells from high glucose damage. It regenerates other antioxidants like vitamin C and E and helps improve insulin sensitivity. In patients with diabetic kidney disease, a growing problem across the United States, especially in southern states with high rates of obesity, alpha-lipoic acid has been shown to reduce inflammation in glomerular cells and slow the breakdown of filtration capacity. What makes it even more promising is its ability to cross the blood-brain barrier, offering protection to both the nervous system and the renal system. People dealing with diabetic neuropathy often experience improvement in both nerve symptoms and kidney biomarkers when taking alpha-lipoic acid regularly. And then there's vitamin A, which is essential for the repair of epithelial tissue, including the delicate lining of the urinary tract and renal tubules. However, too much vitamin A can be toxic, particularly in people with advanced kidney disease, where excretion is impaired. That's why food-based sources like beta-carotene from carrots, sweet potatoes, and leafy greens are safer, because the body converts only what it needs. In Canada and Australia, where winter diets often lack fresh produce, subclinical vitamin A deficiency is not uncommon and can impair immunity and tissue repair. Vitamin A also plays a role in immune modulation, which can affect autoimmune kidney diseases like lupus. But care must be taken with supplementation. It's best to use a multivitamin with balanced levels or focus on provitamin A carotenoids from plant foods rather than high-dose retinol supplements. Finally, we have zinc, a trace mineral that functions like a vitamin in the body due to its critical role in over 300 enzyme systems. Zinc supports immune health, blood sugar control, and DNA repair, each of which is crucial for keeping kidney cells healthy. In dialysis patients across United Kingdom and United States, zinc levels are frequently found to be low, leading to impaired wound healing, immune dysfunction, and even taste disturbances. Zinc also helps regulate inflammatory cytokines and protect against heavy metal accumulation, which can be especially damaging to kidney tissues. Cadmium, mercury, and lead, all known nephrotoxins, can displace zinc and accumulate in the renal cortex, leading to structural damage and reduced function. Proper zinc intake competes with these metals and reduces their toxic impact. But it's important to avoid overdosing, as too much zinc can lower copper levels and create imbalance. A daily dose of 15 to 30 milligrams is typically safe and effective for most adults.